viewers, you're most welcome to our program today. I'm called Dr. Peter Nuwagira. I'm a pharmacist and a lecturer at Mbarara University of Science and Technology. I also do community pharmacy practice with Pecos Pharmacy and many other pharmacies that are part of Pecos group of pharmacies. So I want to welcome you into this program. Today we want to talk about rational drug use and safety of herbal medicine. We want to talk about how best can we use herbal medicine. I'm happy to know that herbal medicine is highly used, especially in our country, here in Uganda and largely in Africa. More than 85% of the population in Africa use herbal medicine. And even in Western world, there's a lot of use of herbal medicine. And we are seeing even a resurgence or more passion, okay, into studying and use and practice with herbal medicine in these last few years. So herbal medicine is a very key area of discussion, especially these days. And I want to talk to us about how we can, benefit, how we can use herbal medicine to the best, because many things or many times herbal medicine is not used the way it should, and no wonder we have seen a lot of challenges with both people who are producing, people who are marketing, people who are selling, people who are using herbal medicine. So start with, let's define ourselves. Let's define ourselves what herbal medicine is. Herbal medicine, these are drugs that we get from plants, okay, from our natural plants. So these are drugs, you can take them raw as a herb, or you can actually go into your lab and process, okay, screen some of the phytochemicals or the ingredients that can give you the medicine part. So you can go and screen them and formulate a herbal medicine, make a formula for herbal medicine, which you can produce in the lab or in an industry, in a factory, and it is on the market. So that is herbal medicine. It is gotten from natural plants. It can be taken raw. We have seen many people, they go to the garden, pick some herbs and eat for their diseases. But we have also seen those who pick them from the garden, process them, okay, try to purify them, okay, and put them to for commercialization. That also reminds me of many people who don't distinguish between herbalists and traditional healers, okay. So herbalist, you can be a traditional healer when you're using herbs and any other and any other procedure in healing, especially using traditional methods. So herbalists are those who strictly use herbal medicine for healing ailments. But we know that there are many other traditional healers who may not necessarily use herbal medicine, okay. Some are spiritists. You've heard those who say, witches, or okay. So those are traditional healers. So herbalists are very important people. Like I said, herbal medicine has been with us as traditional medicine since time immemorial. Okay, but we know that as the world has advanced, herbal medicine has continued also to grow, okay, from being just traditional to actually being what we call complementary and alternative medicine. It is now being used alongside our Western medicine or conventional medicines, okay? So it is part and parcel of the healthcare system now in very many ways, and it is the use of herbal medicine is actually increasing. So then, why are people using herbal medicine? Like I told you, 85% of our population in this country, or even more, are using herbal medicine. Why? Because it is accessible. It is from natural plants, and so we go there. It does not need, you don't have to go through, a lot of bureaucracy. You can go to the garden and pick your herb and use it. So it's accessible. Even those who pick it by the one go and process it, it is still accessible. Many people can still access it, either from herbal clinics or now, conventional community pharmacies. Okay, we are stocking herbal medicine that is being that has been notified by National Drug Authority. Okay, so it is accessible, then it is affordable. It is comparatively cheaper. It is comparatively cheaper than Western medicine because it is from natural plants that are all around us. The other thing is that it's culturally familiar. Okay, most of our cultures understand, herbal medicine. They have been used by the ancestors. They have been passed on to, to the children and now the grandchildren. So that is the reason why it is highly used. Of course, many people also say it is safer. It is safer because it's from natural medicine. Most of the side effects of herbal medicines are not as detrimental, are not as severe as if you take an overdose, for example, of a herbal medicine, okay, like herbal tea for cough. If you take an excess dose of it, it may not be as dangerous as if we gave you a Western medicine. Okay, an example could be maybe salbutamol, or salbutamol is found in many cough syrups because it helps with the respiratory congestion. Okay, it relieves the congestion. So if you take an overdose of salbutamol, you're likely to get heart arrhythmias, okay, or the heart starting to pump, and I mean that is more easy. It is easier to get that side effect. Why? Because for the Western medicine, the dosage is a little more strict than for herbal medicine. So it's true that many of the even the side effects are not as detrimental. So it's herbal medicines are fairly safer. Okay, but we know that safety has other things, because what we consider in safety is you must take it the way it should be taken. Okay, so even herbal medicine, it still has its side effects, I mean, and you don't know when you will suffer a bad one from a herb. Okay, but like I discussed already, they are largely safer. There is that debate between which of these is more effective, Western medicine or herbal medicine. Both work. I can assure you that in most community pharmacies now in this country, even in the developed world, okay, they stock some of the herbal drugs, okay, some of the herbal medicines that have been regulated by the regulatory bodies like National Drug Authority for Uganda, or like African Medicines Agency, or European Medicines Agency, or Food and Drugs Administration of the US. So they are being regulated, okay. They may not be as strictly regulated as the conventional drugs, but they also have regulation mechanisms. So then there is, when we talk about herbal medicine, we want to discuss how can we maximize the benefit of herbal medicine. The benefit of herbal medicine. One, because we have seen many people take herbal medicine and maybe it does not treat them for the disease that they've taken it for, or it does not give them the best benefit, okay. And these are drugs, so drugs are always given in dosages, okay, because they have to be regulated, otherwise they can cause adverse drug reactions or adverse events or side effects. So the best way to maximize your herbal medicine, one, is to get it from licensed people. Get it from licensed people. I know many of you are going to ask me, but they are available anywhere. Even when you go to the market, you'll find a certain powder being sold, okay, and you will take it. Yes, I know that it may help you, okay, but to get the best out of any medicine, it is good to get it from licensed people, okay. One, now herbal medicines are in community pharmacies, okay, they are in hospitals, they are in pharmacies in the different clinics. So get it from a licensed. There are even licensed herbal clinics, okay, they are there. So you go and get from the licensed people. That is one way, such that when there is a problem with your herbal medicine, you know where to go back and get it rectified, okay. Or when you get a herbal medicine, a herbal drug, and it works for you, you know where to go back next time, okay. Or you even know which people, okay, either the manufacturers and their agencies, okay, where those drugs are. So it helps you to track your use of herbal medicine, and that is very important, because when it comes to health, it is important that you know what you're taking. It's not enough for someone to tell you that this drug heals this and this, okay. It's important to know that what it says it does actually has been tested, and it does. So that is one. Get it from licensed persons, or herbal clinics, herbal drug shops, our community pharmacies and drug shops, okay. So the second is, should you have any side effects from them, okay, you call where you got the drug. Why? Because the moment we stock drugs, you are supposed to take responsibility of what they can cause. So that is why in most pharmacies they have books that track adverse drug reactions, okay. We track them. Anything, if I, for example, if I give you Genacid, which is supposed to help you with peptic ulcer disease, okay, and instead it causes you diarrhea. I'm just giving an example because it doesn't cause diarrhea actually, but if it causes diarrhea, then I should take note of that I think this could be a problem either with the drug or with the person, or with another condition that you could be suffering. So it helps you to get back your health even when they are untoward events, or when there are side effects that you don't expect from the drugs. The other thing, of course, as always, when we are taking drugs, declare what other things you could be taking, because it can be affecting, it can affect the drug, or the drug can affect that food that you're taking. Okay, even in herbal medicine, there are herbal drugs that we don't take with alcohol, for example. Okay, or there are drugs that we don't take when we are pregnant. Okay, I remember recently when Professor Patrick Wang, okay, was showcasing the use of Covidex. Okay, he clearly put it that it is not for use in pregnant women. Okay, should be taken with caution, or not even taken at all. So even with herbal medicines, to benefit from them, you should take them in their right indications, the way they have been told you. Don't take Genaseed for manpower, okay, or don't take Covidex for diarrhea. So it's important. There are different herbs or herbal medicines for the different diagnoses or conditions. So it's important to take as prescribed. Take your drugs as prescribed. The other way is storage is very key. When you take them at home, store them. Give respect to drugs, because they can make or break. They can, make you healthy, or they can actually be poisons. So store them well. Okay, don't put them under the sun. Okay, for those which are supposed to be in the fridge, put them in the fridge. Okay, and that storage is very important. That way we are going to maximize the benefits of herbal medicine. Like I told you, herbal medicine is highly used because it is culturally familiar. Okay, we know, and most of us know, these herbs. It is affordable. Okay, it is accessible. We can always find it anyway. So it's important. Now I want us to talk about safety of these drugs. It's important to think about safety when you talk about drugs. The same way you're talking about the benefit of the drug is the same way, or the efficacy, the same way you should be thinking about what happens, the side effect. Okay, when you get a herbal medicine, any herbal drug in its pack, read around it and see its expiry. If it doesn't have an expiry date, then don't take it. Don't take it, because if you are not sure when the drug will expire, it may have expired before you even take it. So read and let your health practitioner, or the person that has given you the drug, help you with all the questions that you could be having, so that you are safe. Okay, we have to maintain safety, okay, over herbal medicines. Don't take them just because they are herbal medicines. You can do anything with it. Okay, so make sure that the quality should be the right one. The efficacy, when is there an indication? If they are telling you it is for the stomach, okay, use it as that. If they are telling you it is, so that is why as we go along, as we go more into advancement of technology in producing herbal medicine, most drugs are going to be more directional. They are going to be for particular indications. This thing of it can treat boils, okay, it can also treat flu, it can also treat cough, it can also treat peptic ulcer. It's unlikely that you will get one drug that treats all the conditions, and that is what most people are using herbal medicines as. And take it for the condition it is supposed to be taken. Okay, there you're maintaining safety of your drug. We are in an information age. There is so much. You can now Google and find confidence. You can now Google and find. So empower yourself with information about herbal medicine. Okay, just like you get if you're taking your antihypertensive, conventional medicine, these Western drugs. If you're taking your amlodipine, if you're taking your bisoprolol, even when you're taking herbal medicine that is used for hypertension, okay, read about it, what its benefits and its likely side effects. Okay. The other thing, like we said, declare when you have concomitant or comorbidities, concomitant conditions or comorbidities, other conditions. For example, I could be taking Genachua for my dental caries, but I know that I am diabetic, and maybe diabetes is predisposing me, is causing me to have those dental caries. You should be managing diabetes as well. Okay, so your practitioner, your healthcare practitioner, that's the problem with when you get drugs in the markets, when you get drugs on the roadside, in the bus. Okay, they will, when they say Genachua is for dental caries, you pick it for dental caries, not knowing that there are other diseases that can actually predispose you to dental caries, for which you should manage. Okay, so it is quite important that we have to think about the other conditions that people suffer. Okay, so what are the challenges of herbal medicine? Either as a practitioner, like some of us who run drug outlets where we stock herbal medicines for our clients, or as manufacturers, okay, when we go to the lab and manufacture, or as marketeers, or as people who actually cultivate these herbal medicine, these herbal plants in their gardens. Okay, there are challenges that we think people should know. The government, the responsible people should know, the different stakeholders should know. Okay, and one is a problem with policy. Okay, there is not enough policy on regulating herbal medicine. Okay, I know that there are policies, of course, touching relevance to herbal medicine, but maybe we need to do more. For example, there was a problem with intellectual property rights for Covidex. So how do people, if I go to my garden and maybe mix my herbs and discover a herbal formula that can treat syphilis, okay, and I bring it to the lab to produce it, okay, what are the chances that I will have the patent, okay, or the intellectual property rights assigned to me? Okay, so there should be policies that help with that, so that there is more production, there is more research in herbal medicine. People are fearing that there is unfair competition in herbal medicine. Okay, because some go to the lab and produce for commercialization, while others are in their kitchens. National Drug Authority does not know. Okay, and you find them in pharmacies also competing with those that have gone under judicious research processes. So it's important that we have policies in place to help with that. The other is policy on safety, okay, and reporting of adverse drug reactions with herbal medicines. It's important. There are not many good policies in that direction, but it's important to give pertinent focus on herbal medicine and how we can track its safety so that we can sustain these good herbal drugs for many generations. Okay, then of course there is also a problem with the limited recognition of the contribution herbal medicine has made to the healthcare system or the healthcare sector. Okay, most herbalists are not as recognized. They are not given the attention they deserve, the support. Okay, I think there is government needs. I know it has done something, and especially during this corona COVID-19 pandemic, but we can do more. We can do more with recognizing herbal practitioners, both those who are herbalists in the gardens, those who come to the labs, those who market, and those who actually stock, because they are promoting herbal medicine use. Okay, so they need to be supported through just simple recognition. Then our education system rarely values local knowledge, and it's a big challenge because it's just recently that universities are starting to put more emphasis on teaching herbal medicine, its cultivation, its commercialization, its production, okay, and even training. Okay, our education system, for example, these herbalists that are practicing in their herbal gardens, in their herbal clinics, they need certification to know that they have been in this practice long enough. They need some bit of a certification so that people can they can expect quality service from them. Okay, it improves on the responsibility on the part of the herbal practitioners. Okay, so our education system needs to take more in consideration herbal medicine, or what we also is part of complementary and alternative medicine. Complementary and alternative medicine, it's important that we put it as part of the, you have a curriculum as part of, people who are, I'm happy that, for example, at Mbarara University of Science and Technology, we have masters now. Okay, we have masters of people who are doing natural products, pharmacognosy, which is dealing with natural products. Okay, they are how they are cultivated, how they can be produced, okay, how they can be commercialized, and everything. But we are calling upon so other universities to take up these efforts, because it's important. It is a way of helping the healthcare system also have herbal medicine as part of mainstream healthcare system. It's quite important. I'm happy that I think last year there was a bill that was passed regulating traditional medicine. Okay, so we want to see how it will be implemented so that all the key stakeholders come on board and we support herbal medicine. So we need to have these traditional healers, herbal practitioners, as part of the healthcare system, recognized, okay, as part of the healthcare system, so that herbal medicine practice can be sustainable. Okay, it can be sustainable. People can know that taking a herbal medicine is okay, and it will actually treat, and it will get the most benefit. And also for more people to invest. We have investors in many other things, but we also need more investment in herbal medicine, because it's going to help us a lot. It's going to help us a lot. So to summarize our discussion on rational drug use and safety of herbal medicine, one is that we recognize that herbal medicine is highly used in our community. Secondly, we also recognize that it is being sometimes irrationally used. Okay, so we need more rational drug use with herbal medicine. We need to keep our herbal medicines safe, okay, and we are calling on the government and other stakeholders, okay, to be part, of building policies that are going to help herbal medicine to be used rationally, to be used more effectively, okay. And then lastly, I want to thank TV. I want to thank the supporters of TV who are at the forefront of showcasing, okay, what happens out there in the community and how people can actually benefit from the many efforts that people are putting in, especially in our health sector. People are putting in to treat patients better and to achieve best outcomes, okay, best health outcomes for our population. Thank you, and we pray that all of us shall be in support. We thank you.